to our 6th monthly seminar for the school year 2017-2018. Allow me, it is my honor to introduce our speaker for this afternoon. She is a full-time professor of the University of the Philippines, Manila, under the National Teacher Training Center for the Health Professions, where she is also currently serving as chair of the Office of Extension and Continuing Education. She is likewise a faculty member of the UP College of Medicine. She obtained her medical degree and master's degree in health professions education from UP College of Medicine and NTTCHP respectively. She is specialized in internal medicine and in gastroenterology at the UP Philippine General Hospital Medical Center. She is a member of the committees on faculty development and continuing medical education of the Association of Philippine Medical Colleges and has served as a course coordinator of the series of workshops conducted by the said association from the school from year 2015 to 2017. She is a practicing internist and gastroenterologist at the UPPGH Medical Center. Allow me to welcome Dr. Melflor Aldovina Atienza.
Okay, good afternoon. This is second to the last of this academic year. And then next year, well, not next year, but next academic year, we'll be starting another series, and that would be on transitioning to outcome-based education. So tapos na tayo dun sa simula, transition na tayo. Para sabi, outcome-based na naman. Pero that would include topics like curricular, organizational, and quality assurance, which I think a lot of us would want to know more about. Ano pala yan? Inter-university workshop natin sometime in June, but you will be given your invitations later on. So for today, we will be talking about outcome-based assessment. And my first question is, how many of us here have heard of outcome-based assessment? Parang yun lang, hindi pa makatash. Siguro naman, no? Okay. Heard, ha? Of outcome-based assessment. So, sino? Merong hindi pa rin, no? Okay. Nakataas lang po ang kamay and remain so, if you know what it is. Know what it is? Nakataas pa rin. May mga bumaba. Can you explain how it's done? Hindi lang daw alam kung tama, pero may explain. And can you show us how it is conducted? Okay. Medyo nandito na lang sa side na to. Lastly, how many of us use it? Wow, may mga natira. Okay. So, what I just asked you, sige, pwede na bumaba yung mga kamay, is actually one, kung if you know what it is, nasa nose level lang tayo. If we know how it is done, then nasa nose how level tayo. If we actually can show it, demonstrate how we use it, then it's on the shows how level. And if we use it, edi does. Does that sound familiar? Narinig nyo na ba yan? Levels na yan? Yes. Pabaliktad lang usually, no, kung nakikita nyo. What I actually ask you is similar to what Miller showed us as the way to train and to assess. So, yan yung kabaliktaran ng Miller's pyramid, which actually starts from knows how, shows how, does. So, the bottom is the nose. The nose is knowledge. And then one step up is knowing how, that's competence. Alam mong gawin, kaya mo, naiintindihan mo bakit ganon, bakit ginagawa, that's competence. And if you can show it, that's performance. And if you do it, that's behavior or action. So yun yung iba't ibang level. levels. So that if this teacher, parang nakakatakot yung itsura niya, I got this from the internet, I found it very interesting. If this teacher is actually assessing his students if they know how to swim, hindi pwedeng ang gagawin niya ay ganyan. Diba? Kasi sabi dun sa internet, dry run lang daw yun. No? Okay. So, and this is a sport, no, swimming. It reminds me of, actually nakwento ko na to dun sa workshop namin sa GE, of my physical education class. Kasi nung high school, my PE class was before my algebra class in second year. And I couldn't wait to get to algebra class. Kasi at least doon, hindi ako fourth from the bottom pagka nagtatakbuhan. And in college, the highest grade I got from a PE class was here, badminton. Pero yung badminton, I got high, I think, because I didn't do a single serve. Kasi PE1 siya. Actually, ang task doon is to make a plan, a wellness plan that included any sport that you want. And so I just had to discuss what badminton is, how it will make me stronger, healthier, even if I really didn't do it. No? So theoretical lang siya. When it comes to outcomes, yun naman kasi yung outcomes na gusto nung teacher na we can make a plan, so I did well. Kung ang outcome niya ay performance, I'm sure I'll drop the course. Okay, so ngayon, for outcome-based assessment, we will ask ourselves just 3 questions. Why we're doing it, what are we assessing, and how we are going to do it. So dun sa why, and along the way, we will also define what it is. No? So in the why, bakit tayo nag-a-assess? We are familiar with, kasi we want to make students learn. Second, we want to grade them, whether they be kicked out there, be promoted. We will give some recognition or awards for them. In one article, the assessment goal was providing direction and motivation. And somehow I like that more than just giving formative feedback. Kasi parang ito, you're not just teaching students, you're also motivating them for future learning. So hindi lang siya basta, sige, itong kulang mo, so kailangan mong gawin kasi otherwise hindi ka papasa. Pero it's really motivating them for future learning. Second is protecting the public, especially in the health professions, because we want to make sure that future health professionals will be competent enough to take care of patients and clients. And a service basis, of course, for decision-making regarding students or regarding trainees. And this means that either the trainees will be given or will be promoted, they will have some remediation, or will they not be, or will they be expelled. So yun ang ating goals for assessment. Next, what are we assessing? What are we assessing? Ano ba yung ina-assess ng outcome-based assessment? Siyempre, outcomes. No? My first topic, the first topic that I gave in the monthly seminar last September, I think, was on the course, on the outcomes. No? Formulating course outcomes from program outcomes. So babalik at babalik din tayo doon sa program outcomes. Who among you were here when during the, siyempre sa halip ng kamay, mga cellphone, nakaganon. So I suppose yung mga gumagano ng cellphone, sila yung wala dito. No? Who among you were here during that time? Yan. Okay, so I discussed about program outcomes of the different health professions. And if you will remember, I mentioned that some of them are quite similar. May mga generic outcomes for the different fields, and there are special or specific outcomes for medicine, for nursing, for PT, and the like. So the doctor of medicine CMO 18 series of 2016 contained the program outcomes for medicine. There were 10. BS Medtech, yung CMO 13, down the line. And para lang maalala natin, these were the common outcomes for the different fields. So we start with demonstrate clinical competence in specific professions, demonstrate leadership and management skills, practice according to ethical professional legal standards, engage in research activities, demonstrate effective communication skills, interprofessional collaboration, lifelong learning. And the different fields included this as shown. So yung numbers dyan, yun ang numbers dun sa CMO ng outcomes na ito. No? So 1 or 2 lagi ang demonstrate clinical competence. And leadership is there. Kung titingnan nyo, halos lahat din ang outcomes. No? Meron lang mga ilan-ilan na hindi included. Next. So, engage in social advocacies, be a competent educator, utilize systems-based approach in delivering healthcare. Meron pang entrepreneurial skills. Sa tingin nyo, saang profession kaya yon? Nursing, PT. Use of technology, apply basic knowledge, demonstrate higher order thinking skills. So tama, nursing and pharmacy and PT and dentistry pala. Technology, so dito mas less yung similarities nila. Pero the same way, no, there are common program outcomes. I'm going to be using this later on. Okay. So from those outcomes, paano natin ngayon siya i-match o ilalagay o i-insert doon sa pyramid ni Miller? At the lowest level, when we want to see what they know or their knowledge, then we assess basic and clinical sciences and maybe some concepts in research. If we want to assess if they know how, then skills ito, clinical skills. Of course, higher order thinking skills or critical thinking skills, research, systems-based approach. If you want them to show how, then kasama na dito yung clinical skills, again, communication skills, interprofessional practice, leadership, systems-based approach, and technical skills. And we want to see practice or action or behavior. Diyan yung clinical competence as a whole, ethical, professional, legal practice, and personal development. So, bawat isang level din ng pyramid na address yung mga iba't ibang outcomes. Paano? Back to the pyramid, if you want to test knowledge, I'm sure you have seen this several times. Written exam, oral exam, yung ibang reports, knows how, written exam, oral exam. Of course, if we want them to show us how, it has to be some form of practical exam or a structured exam such as the Objective Structured Clinical Examination or the OSCE. And yung performance, it's workplace-based assessment. There are a lot of them. So dito, nilagay ko lang yung direct observation, documentation, or case logs, reports, discussion of cases, feedback-based assessment, portfolio. We'll go into that in detail later. So, doon sa pyramid na yon, nailagay natin yung outcomes, nailagay natin yung assessment methods. Before we see how it's going to be or how the literature would say we do it, let's see how we do it first. I made a survey of, I'm not sure if some of you are respondents to this. I had 102 respondents. And these were our students, alumni, health professions, teachers. And yung ito, these are not their professions necessarily, but these are the students that they teach. So ito, yung 34%, they teach medical students. 13% Teach BSPT students, 11%, BSN, other undergrad bachelor degrees, 10%, DDM, 6%, OT, 5%, postgrad, so mga master's degree, 5%, and so on. Okay. Ano yung practice ng health professions teachers? They spend 1/4 to half of their time assessing students. And that's quite a lot. And to us, to me, it's a good sign because that means it's not just during the final exam that they think they're assessing their students, but they do that sometime during their course so that it becomes, hopefully, formative assessment. Pero merong 0 to 25% din. Meron yun na lang ang ginagawa, no? 76 to 100%. So, iba't iba talaga yung range din. What do they use? Kita nyo ba? Siyempre, pinakamarami pa rin nagbibigay ng final exam. Long exam, which means midterms, prelims, attendance kasama, quizzes, number of respondents yung x-axis, no? Case discussion, SGD, tapos paliit ng paliit. May OSCE, clinical performance, assignments, oral exam, peer assessment, self-assessment, portfolio, attitude, yun. Merit, demerit, mini CX, no? So, pakonti ng pakonti. So, you see the majority of us still are heavy on the written exam. Okay, anong ibig sabihin yan? On the x-axis are the different assessment methods, right? Final exam, long exam, clinical performance, OSCE, quizzes, and so on. I just wanted to show the different percent, the percent of teachers using this particular assessment method. For example, the final exam, how many of them give the final exam a weight of 1 to 25%? That's the blue bar. The pink bar above it is the percent the percent of teachers who give the final exam anywhere from 26 to 50%. So, yung long exam naman, so you see, mas marami, almost more than half of the faculty would give the long exam maybe between 1 to 25% of the weight. Tapos, the pink one, and then yung green, ibig sabihin 51 to 75%. Yung yellow, 76 to 100%. So yung final exam, merong 12% of the respondents who used final exam give it a weight of more than 3/4 to 100%. And if you see the red line, the red bar, na pataas ng pataas as we go to the self-assessment on the other end, are those who do not wherein these assessment methods are not included in the final grade. So yung assessment method is not included in the final grade of more than 50% of those who use it. So binibigyan lang ng self-assessment yung students, but it's not included in the grade. And if you will notice, the grades which are given less weights, o yung hindi graded, are those which are self-assessment, portfolio, reflection papers, peer assessment, iba mga soft skills, no? Assignments, attendance, yon. Those who are given more weights are final exam, long exam, clinical performance, and the OSCE. Another thing is, one of the high emphasis of outcome-based education is we try to teach our students and we try to give feedback so that they will improve. So yung the blue bar are the number of faculty or respondents who use the final exam. Yung red, yun ang nagbibigay ng feedback on the final exam. Okay? So kung by eyeballing, roughly half of those who give the final exam and only half give feedback. Ganon din ang long exam, no? A little more than half. Ang attendance, mag-absent ka siguro, hindi ka naman bibigyan ng feedback about it. Quizzes, more than half. Ang case discussion, almost all. Ang small group discussion din, at saka look at clinical performance, no? Doon heavy ang feedback, which I think is good because clinical skills would be there and you will be giving feedback to your students. So more feedback are given to reports, to critical appraisal, oral exam, peer assessment, self-assessment, portfolios, compared to the final exam, the long exam, and quizzes. Right? Eyeballing. Do you recall which ones are not graded? So those two, ito, di ba, yung mga long exam, midterms, prelims, pero sila yung mas less yung feedback na binibigay. But they are the ones which are in the grades of the students. On the other hand, the self-assessment and other aspects there, like portfolios, which are not really included in the grades of most of the faculty, are the ones in which they give feedback. Okay, so wala naman to just a reflection on maybe we need to give more feedback, especially on those things that we think should be part of the grade of students. Ano yung difficulties? I asked this as well, so I'll know maybe where we can help as well. So making exams, checking exams. Paggawa hanggang pag-check. Reflection paper, siguro checking. Attitudes assessment, the OSCE grading, giving feedback down the line. So, test construction pa rin, ano? Siguro kasi most of you are really into test construction. Okay. So, that's how health professions teachers in this survey assess their students. Let's, you have your handouts. Nabasa nyo ba yung kaso doon? Let's read the case. The first case. Ano lang yan? Parang take-off point of our discussion. Okay. So, yung first case, BSPT students get high grades during the first 3 years. Grades are usually computed from quizzes, small group discussions, and the written exam. Clinical instructors, however, complain that PT interns cannot assess patients properly. When asked during case presentations, they cannot answer basic science questions and fail to justify the plans that are plans of assigned patients. So ang question dyan, what do you think are the problems in this scenario, the issues in testing in this scenario? Ano-ano bang problema dyan sa scenario na yan? Okay, pwede kayang para, maybe one, 2, or 3 of you can write on the board para lang makita natin. May whiteboard doon. Sino nagtuturo ng PT? Okay, itong grupong to, maybe you can identify the issues or the problems in that scenario. Hindi kailangang malalim na analysis. Anong problema doon? Kahit sabihin na lang kung ayaw niyong salat. Anong problema nung kasong yon?
Good afternoon po. One problem with from Our Lady of Fatima University. Uh, One problem, actually this case is practice kasi there's a discrepancy talaga or uh, difference between the competencies of the clinical educators and the classroom educators regarding the updates in the practice. Kasi again, in the classroom, it's evidence-based. In the clinics, it's what they learned, practice-based or what they learned back then when they were students. But kasi the educators really updates themselves on what is the new trends in the practice. So sila yun po. That's the problem with the CPD kasi po.
Good afternoon. From UDM po. Siguro ma'am yung no need for feedback. The teachers felt no need for feedback because there's no room for improvement if the students cannot identify their weaknesses.
Other points? Identify.
Yung one reason would be there's a difficulty in bridging the theoretical knowledge into clinical practice or clinical skills. And sometimes, most of the time, hindi po kasi na-simulate yung quizzes, yung written exams, yung clinical reasoning ng bata, ng students. So, na-encounter nila or na-formulate na yung clinical reasoning right on the clinics na, which is difficult for the students kasi hindi sila, paano ba, dapat natitrain pa lang sila on the undergrad, on the early years pa lang.
Good afternoon, ma'am. Siguro, ma'am, dito, regarding the domains, parang yung group discussions, quizzes, more of the knowledge domain. Pero dun pagdating sa clinical, skill kasi yung hinahanap. So, hindi sila congruent. No? Kaya siguro dapat, suggestion for clinical, dapat skill pala dapat yung isa sa kailangan na domain para kung gusto nung clinical maano yung ma-achieve nung students yung gusto nung clinical instructors.
Same. Okay. Okay, so good points, no? Yung discrepancy, pati pala yung evidence-based practice at saka yung practice, no? There's discrepancy. So I introduced here the concept of validity, which means appropriateness and meaningfulness of inferences made from the assessment results. So you test what you really want to test, sa madaling salita, no? So if there's a discrepancy, then there's a problem. Cognitive level of the examination, it's not, wala namang sinabi rito. But when written exams are given, many of them are just at the recall level. So sometimes they will not be able to carry that through or use that in the clinics, no? And the scope, no? Kasi kung written exam lang, small group discussion, it was also mentioned, no? Walang iba kundi knowledge. Meron ding assessment ng kung small group discussion, then there has to be some form of assessment of communication skills, pero hindi naman din clear kung meron. And there's no feedback, which is an important point. So what can we do? One, we have to make sure the outcomes are assessed, no? Or rather, the outcomes to be assessed are in the test blueprint. And when we talk of outcomes, these are outcomes of significance. Hindi siya yung mga details, mga irrelevant things, kundi yung mga mahalaga for the future practice of the profession. And that's what the clinical or the internship is preparing them for. So kung hindi sila ready in the first, second, third, fourth year, then they won't be ready for that in clerkship. And that's where they're supposed to be prepared. Content and weights as well, no? And there was no mention of how good or how well the questions were written. Pero basta yan, kahit written exam kasi, pwede namang may konteksto. May konteksto, may analysis, may evaluation. So, if these are there, then they can be pwede ding transferable yun. Okay. The length of the exam, frequency, repetition, have to be included have to be part of the consideration whenever we do the assessment. Kasi kung halimbawa isang written exam lang, isang small group discussion o dalawa, pagkatapos mga quizzes, at minsan ang mga quizzes paulit-ulit o ang long exam paulit-ulit. Imagine making 100 questions for the final exam every year or every sem, every time a new batch comes. That's quite a big task for teachers. So sa atin nga, sino ang nag-uulit ng questions? At alam naman natin na basta inilabas mo at nakita ng mga mata ng estudyante ang tanong, alam na yan ang susunod na batch. Ganon din naman tayo dati, 1 to 10 ka ha, 11 to 20 ako. Tapos, para alam natin mabubuo yung exam, no? Or the idea of the exam. Meron naman, binabago lang ng konti. Pero okay lang baguhin eh. Halimbawa, sa halip ng 8 years old, yung pasyente, nagiging 9. O kaya sa halip ng Rose, yung pangalan, nagiging Mary Rose. So, naiiba naman. But repeating the questions would mean that we're no longer testing the higher order thinking skills of students, no? We can assume, of course, they don't have the copy of the exam or nobody coached them from the upper years, but in reality, that seldom happens. Scoring as well, if it's an essay exam, then how do we score that is also an issue for students. So the students may get inflated grades just because it's not really testing higher order thinking skills and analysis, just because it was repeated from previous exams, or because small group discussions are not really graded. Parang pass na lang ng pass kasi basta nag-usap sila, okay na siguro yun. No? Pero so that they tend to have high grades there and we think there's no room for feedback when in fact they're not prepared for the clinics yet. So we can improve reliability, which is consistency of results, if we do more assessment methods instead of just sticking to the written exam and do it at greater frequency. And small group discussions would be a good way to test their higher order thinking skills as well. Okay. Sige. Ito na. When we assess knowledge, kanina sabi natin, baka hindi tama yung cognitive level of the things we assess. And according to Anderson, which is the revision of the Bloom's taxonomy, may mga facts, no? Alam natin yung facts. Ano ang gamot sa UTI? Ano ang bacteria? Ano ang bacteria of, yun ang pinakamabilis na. Anong bacteria ang nagiging dahilan ng tuberculosis, etc. So those are facts, but they are important facts. Even if they can analyze, get the diagnosis, ano nga ba yung antibiotic na yon? No? Hindi naman pwedeng lahat na lang titingnan nila, kukuha sila at kukuha ng kodigo, maghahanap doon. No? So there are certain facts which are very important, which are essential, and it's okay to ask them those questions, but we cannot stop at that level. So may concepts then, pathophysiology, mechanism of action, etc. Higher procedures, no, procedural knowledge. So ito yung algorithm, no, na parang kita mo yung experts para silang may algorithm na sinusunod sa utak pero mabilis. No, when they manage, when they assess patients. And metacognition is knowing your own knowledge, no, being aware of what you know, what you don't know, and how you learn best. And this knowledge domain should be tested, pero hindi lang yan. Meron pa rin kasama yan na what process, or ito yung cognitive process, is linked with these domains of knowledge. So, ibig sabihin, are we just recalling information? Are we understanding concepts? Are we understanding pathophysiology or the mechanism of action of certain drugs? Or pathophysiology of certain diseases, or even physiology, no, the flow of blood in the veins, etc. And procedural skills, no, If we will just make them enumerate the steps in taking the blood pressure, dito lang yan, recalling some procedure, no? But what we need to do is, halimbawa, define hypertension, and we need to start with that. Kung hindi nila alam kung anong cut-off pala ng hypertension, may 180/100 yung BP, okay lang po yan. Sa edad yun naman, pwede na yan. No? So, hindi pwede yun. And then, they have to understand the pathophysiology of important diseases, computing the dose, no? So, cognitive pa rin yung procedure na yon. Diagnose, given a case, etc. They will analyze. And then, if there are so many things that you can do, if they are at this level, then they can make judgments based on what's correct and what is not. And prioritize, for example, the management. Anong pinakamahalaga sa management ng isang pasyenteng may cholera? Antibiotics ba yan? IV fluids ba yan? Or kung ano, kailangan alam nila, mas mahalaga pa sa antibiotics, kailangan fluid replacement if the patient is dehydrated. So if they're at this level, then they would know. Pag metacognition, ma-apply din nila ito sa sarili nila. May knowledge na, may application, may analysis, at may alam din sa sariling conditions. So, point is, as our students go through the lessons, and as we are assessing them, siguro sa simula yung assessment natin, mainly recall, mainly explanation of some concepts, pero habang tumatagal, kailangan lumalalim at lumalawak ang mga tinatanong natin. This is one diagram which I like. Ito yung kay Harden in 2007, pero 12 outcomes yung kanya eh. So, imagine nyo na lang the number of outcomes. Kung nursing kayo, 14 yon. Kung medicine, 10. These are the different outcomes of performance for that particular field. Tapos, halimbawa, sa first year hanggang dito lang. Sa preclinical, umaabot yung iba dito, yung kailangan, yung expectations. And then, pagka-intern na, nandito na. Pag-residente na, dapat yung buo na. So, it's good to imagine that what we try to develop in our students, in our trainees, is not just one outcome. Lahat din ng outcomes. At kung lahat ng outcomes ang dinedevelop, lahat ng outcomes din ina-assess. And it should be increasing in breadth. Ibig sabihin, mas lumalawak yung scope. Increasing in difficulty, mas mahirap na. Mas less na ang ating cues or clues. No? Yung kasong ibibigay mo during the first day, hindi rin naman yun ang level ng kasong ibibigay mo o level ng questions na ibibigay mo at the end of the course or at the end of the rotation. Increase utility and application to practice. So may practice na yan later, no? Because you want to integrate them into their role in the profession and increasing proficiency. Kung mabagal yang mag-take ng blood pressure at napakahinay maglagay ng cuff, abay, siguro pagkatapos namang magawa niya yun sa 100 pasyente, hindi dapat ganun din kabagal, no? So may increasing proficiency and speed and accuracy. Knowledge pa lang yan. Ang knowledge, sabi natin, yung recall, understand, apply, remember, analyze, evaluate, and create. Diba? Yung sa dimension ni Anderson. Paano pa yung skill? Na merong perception or set, prepare natin sila. And then, we will guide them, we will teach them, we will do demonstration, return demonstration, until they become proficient. And then when they're proficient, they can do it in complex cases or complicated conditions. More than that, pagka talagang mas mahirap na, they can make changes, they can adapt, they can adjust. And then later on, then maybe they will create new acts. Siyempre, hindi naman kumpleto kung walang attitudes. Ganda, no? Alam na alam ko kung yung sign, kung yung frame ko tapos na, kasi tataas na uli yan. i-upload naman namin, pero okay lang din kunan ng litrato. So, ang effective domain, you receive, no? They are aware of the patient's needs. They will comply. They will do hand washing. They will follow the steps that you tell them because you are there. But when they do it because they appreciate it and they value it, whether or not you're there, valuing level na yon. When they can prioritize what's important and what's not important, organization na yon. And when they have created their own philosophy, characterization. Siyempre, ito medyo mahirap abutin, no? Sometimes it will take a whole lifetime, no, to do that. Pero sa ating estudyante, we also have to decide on the level of the taxonomy that we want to develop or to train our students, and that level will be the same level that we will assess them. Kaya, what I placed here, this is actually a modification of Erlin's slides. Halimbawa, demonstrate clinical competence. At the end of it, they can formulate their own plan. Nursing care plan, management plan. So hanggang synthesis level na yun. Kung research, nakakagawa na sila ng entire proposal, di hanggang synthesis na yun. Kung hindi, edi hindi. Kung skills, let's say hanggang adaptation level, kaya dapat nila. And attitudes, they know what to prioritize. Ano ang values nila? Anong mas mahalaga? Pagka may in labor and you're an OBGYN, hindi pwedeng, magbabakasyon muna ako kung pasyente mo yon. You know what your priorities are. Demonstrating leadership, application of leadership concepts and principles, and they know how to solve management problems in the organization, and valuing, they appreciate the other members of the healthcare team and their role in that team. Kung ethical, professional, legal standards, syempre kailangan alam nila ang tama at mali. So they have to be at least at the evaluating level, complex overt response, and organization level. Sa level na yan, merong situation, there are a lot of options, then they would know which is ethical, which is legal, which is the choice that they should make. Research, yan. Sabi ko nga, if you're expecting them to make a research proposal and conduct it, as many would, then synthesis level sila. Kung sa skills, halimbawa, yung routine lang na data collection at na communicating with the respondents, etc., di ba ka mechanism lang yon. And they have to value or know the importance of following the scientific method, hanggang valuing sila doon. Demonstrate effective communication skills. They will apply the principles of teaching, speaking. They can adapt, no? And then they will value documentation, the importance of doing it completely, legibly, no? Yung iba kasi basta na lang, no? Hindi maintindihan. Even those little things, no? Meron silang halaga. Sa madaling salita, meron na tayong outcomes, alam na rin natin ang domains of learning, at we are aware and conscious of the levels in the taxonomy that are for each of those outcomes. No? Okay. So kung iisipin at titingnan natin yan, obviously the written exam is a good test to check knowledge. Hanggang doon. Pero it cannot, and it has very limited power to test, to assess skills and attitudes. Kaya, kailangan magkaroon din ng ibang method to assess knowledge, skills, and attitudes if we have to be OBA, outcome-based assessment, ni OBE. No? Kasi, we want authenticity. Sabi sa isa, ano bang ibig sabihin nun? If they can, halimbawa, identify materials used in dressing, o sige, di part yan ng pagiging authentic. Pero, if they can give the steps, edi mas malapit pa yon sa the real world. Pero kung nakagawa nila, yun talaga yung authentic. If they can tell you what the thermometer is for, pero a grade school student can also do that, no? Then that's relatively authentic daw. Mas kaya nila pag nare-record nila yung tama. Alam nila yung 37 degrees, hindi sa baba yung degrees, at tama yung pagsusulat nila. Pero if they can use it at nare-record na nila, yun yung real, yun yung authentic. Explaining the steps in taking the blood pressure, sabi ko nga, cognitive lang yon, di lower level thinking lang yon. If they can show you how to do it in one patient, that's fairly authentic. Kung talagang nagagawa nila consistently, accurately, no, hindi lang basta kukuha, no, ng blood pressure, kasi merong iba, normal yung bowel sounds, hindi naman pala naririnig, no? Ina-assume lang normal. Kahit hindi naman pala napapakinggan dahil baliktad yung diaphragm ng stethoscope. But if they can do it consistently, then that's authentic. And we want that. We want performance. We want to see how they actually perform, testing complex, higher order knowledge and skills in the real world context in which they are actually used. So merong open-ended tasks and they are required to complete it. So that's performance assessment. Students are asked, are requested are made to perform, create, construct. Merong knowledge, deeper understanding and reasoning, may work, may action, may behavior, and this is directly observed performance of something that's important. According to Epstein enumerated 4 of the most commonly used performance-based assessment in the health professions. 1, patient management problems. Ilagay lang sa computer, so computer-based clinical simulation. Yung iba, di computer, di parang click ka lang ng click. Di parang PowerPoint na binigay sa'yo, tapos kiniklik mo lang. Pero later on, ang nangyayari na daw, they have several options and you can, depending on your choice, dun pupunta yung kaso, no? So I tried that once, yung isang emergency room patient, no? Hypotensive, tapos may arrhythmia, may MI. So ang ginawa ko, binibigyan ko ng diuretic para maging hypotensive palalo. Tinitingnan ko lang how the computer will react. Nung time na tapos yung lidocaine, I gave it at a dangerously high dose. Pagka ganun pala, yung computer, nagsasabi siya na danger. So, meron naman siyang feedback, no? Pagka masyadong mali yung ginagawa ng estudyante. The oral exam, no? But the oral exam, we said, is prone to bias, but what they did was to make it structured, to give it standardized rating scales to lessen the subjectivity and the OSCE. So, we'll just focus on the OSCE. Objective Structured Clinical Exam. Ilan po sa atin na nag-OSCE? Okay. Marami. Sige. Punta tayo sa pangalawang kaso. So, yung kanina written exam na maraming problema doon sa discrepancy between the clinics and the classroom. Now the OSCE. The OSCE was intended to provide a valid and reliable means of assessing clinical competence in a standardized manner. But its introduction in the 4th year BS Nursing in College B was met with resistance from the faculty. They preferred individual assessment. Doon na lang, pagka magkasama kami sa bedside, doon na lang mag-assess, no? They pointed out that OSCE would be additional load for them and expense for the college. It's quite expensive. You have to pay for the standardized patients, you have to prepare the beds, you have to prepare the venue, etc. An orientation, so what they did was they gave an orientation on the importance of OSCE, how it is conducted, and then it was finally approved and implemented. So 4th year students were divided into 4 batches, with each batch going through 3 similar stations. The tasks for the stations are Yung sa una, conduct nutritional assessment on an adolescent patient with bulimia. So may kunyaring standardized patient doon. So i-assess nila. No? They will interview, they will weigh, etc. Number 2, answer 3 multiple choice questions on anatomy and physiology of the heart. And number 3, administer oral medication to another standardized patient, an elderly individual with diabetes, senile dementia, and refuses to take the medication. Examinees complained that the time given was too short. When the examinees' scores were tallied, the faculty coordinator noted that all students in batch 2, yung second batch, who went through the station on patient assessment under one particular professor failed. The rest passed the exam. Okay, anong issues dito naman? Ano yung problems? Kahit yung sa hindi nag-OSCE, ano yung nakikita niyong problema? Reliability of the assessor, no? Baka siya yung nagbagsak ng lahat. Meron ba, do you plot that? Pina-plot nyo ba yun? Nakikita nyo ba? Si professor na to, talagang nagganonan yung scores nila. Do you notice that? Oh, na-notice din namin yon the first time we ran the OSCE. Yung scores ng student, biglang gumaganon pagka napataon dun sa faculty na yon. It's for several years, no? Pero later, nag-calibrate na rin naman. Okay, so that's one very important problem. Second, what's another issue?
In the tasks for the stations, number 2 is better than otherwise than OSCE because it's multiple choice anyway. It's not a skill or task.
Nagsayang ka ng stasyon, 3 multiple choice, dinagdag mo na lang sana sa final exam, no? At saka hindi siya hindi siya yung practical exam na nandyan yung model ng heart, may say at least yon. Ito talagang multiple choice. What else? Any other problem? Ana? Sige. So we know the OSCE is an organizational framework. It may have questions na multiple choice. It may have questions na it may have stations na oral exam. It may have practical exam stations. But the point is, there are partial tasks done per station. So meron siyang history, may PE, may focused nga na physical exam, no? Not the entire physical exam. Practical procedure, management, patient education, interpersonal skills, communication skills, and so on. So these are the tasks that can be done. So in other words, these are the competencies that can be assessed by the OSCE. Stations, pwede siyang clinical. So if there's an interaction between the examinee and the patient, usually in the presence of a clinical exam, of an examiner, pwedeng dalawa, pwede rin namang yung patient na rin yung rater, if they are trained. Practical procedure or practical station, there's a performance of a technical procedure. And the third is static one. Walang interaction, may responses lang to some questions. Dito sa particular example natin, the first one is what kind of station? Yung may bulimia, may nutritional assessment. Anong type of station? Clinical, kasi may pasyente. Yung pangalawa, static. Yung pangatlo, kasi yun na lang yung natira, practical. May pasyente din naman kaya, no? So clinical din yun. Clinical din yan, basta may patient encounter. But the static station, kahit siya pwedeng multiple choice, we use that for questions na clinical pa rin. Halimbawa, may interpretation of some temperature chart o kaya yung vital signs records ng patient or interpretation or yung ECG findings, then we can have that, no? Pero kung yung talagang multiple choice lang at anatomy and physiology, mas maganda ng written exam. Okay, so if you notice, tatatlong stations, no, very few competencies are assessed. Communication skills lang, tapos yung isa, yung nutritional assessment, so magbi-BP lang. Tsaka yung sa anatomy and histology pa. Time is too short according to the students. So how long should you do that? How long do you give it? Yung nag-OSCE, ilang minutes? 5 minutes. Per station, 5 minutes. So depende. Now we'll see. Siyempre, again, we prepare the test blueprint. What outcomes are assessed, and we determine the proportions of stations for each. We plan the stations, we plan the cases, as well as the scoring sheet for each. Next, paano yung there are too few stations? Examiner, no? Sabi, reliability, kasi yung isang examiner, bagsak lahat sa kanya, tapos yung lahat naman, iba, pasa. And examine issues. Baka naman sila ay hindi prepared for the OSCE, kaya they find it too short, no? Baka takot-takot o kaya ay they think they have to do so much per station. And lack of standardization, kaya iba-iba yung nagiging ratings ng students. There are so many studies, but one by Resnick said, 10 stations, medyo madami, no? Pero ito na may siya lang ang nagsabi, no? Whatever is feasible and practical for us, iyon. 10 stations will give us a reliability of 0.85 to 0.9. So that's quite high. Pero kung tatlo, medyo mababa talaga yon, no? And then we have to orient the faculty. No? We have to orient the faculty not just on the importance of the OSCE, but on how to use the scoring sheet. Kami, merong isang faculty, di syempre, physical exam of the abdomen, ready na yung student. Biglang yung faculty, point to me where the gallbladder is. E di syempre, hindi pa siya maka-inspect, hindi pa niya masabi yung kanyang script na upon inspection, the abdomen is flat or globular. Meron silang script na pero tinitingnan mo lang, di point. Okay? So, how do you test for Murphy sign? E di syempre, parang mamaya pa yung Murphy, nakaplanta na sa utak niya siguro yung sunod-sunod. Nasa dulo pa yun So, meron pang skip. Ito. Okay, point to me where the appendix is. Yun na naman. Dito. Okay, where do you put your stethoscope when... So, in short, nakakataranta siya dun sa estudyante. After that, biglang nag-ring yung bell, 1 minute na lang. Tapos saka magsasabi yung consultant, what are we supposed to be doing in this station? Di 1 minute na lang, paano pa niya magagawa yon? And then later, he ended up saying, siguro naman, pasa siya, no? Kasi alam naman niya yung parts ng ng abdomen. Di ba, hindi naman yon PE nga Hindi nga kung nasan yung gallbladder at appendix. So may problema. We have to orient the examiners. Ensure that the cases setting time will be similar for all batches. Pati ingay, no? Baka kasi hindi... Yeah, sure. Ito, hindi niya sinabi doon pero kasi ito are stations which are different and hindi siya isang rater lang. Ang sabi pala, you can use more raters para at least may inter-rater reliability. Ma-check, ma-counter-check nyo per station. Pero more importantly, mas magandang more stations kahit na less yung time compared to few stations, tapos you give it more time. You give it more time for that. Okay.
Tinatanong ko lang kasi I was wondering is that if I test the students again, ganun din ang labas? Or inter-rater reliability nga between examiners? Or if you compare performance on items across stations across the test?
Kasi iba yun dun sa findings nila ng inter-rater. Hindi din to test-retest ng inano nila. Kasi they didn't retest the students after.
Thank you.
Tapos, of course, yung administration, resources, time, dapat may extrang patients. Kasi minsan yung patients would not come o kaya patients would not be available for that particular time. Although meron ng mga standardized patients who know exactly what they should do. Logistics, no? Pati yung mga kama, silya, etc. Okay. Pero, OSCE is good. OSCE is a standardized way of testing competence. Nagagawa ba niya? But it's still a simulation. So, meron pang isa which is the workplace-based assessment wherein it's not a one-shot deal. Kasi yung OSCE, once lang yan. If you fail, then you fail it, no? Merong remediation naman for certain stations. Pero ang workplace-based assessment is one in which you do it more regularly. You have more ways of assessing students. And I'm just showing you 4 of this. Yung documentation of work, so it's the logs and case logs. Direct observation of performance, discussion of cases, and feedback-based assessment. Under which you have logs, logbooks, case logs, procedure logs, the mini clinical evaluation exercise, or mini CEX, direct observation of procedural skills, or the DOPS, and chart-stimulated recall. Kaya yan dalawa, in the States, they call it chart-stimulated recall. In UK, they call it case-based discussion. Pero basically, it's the same. And feedback assessment. So, yung direct performance, the mini CEX and the DOPS are quite similar in how you run it, except that they differ in what you test or what you assess. So, they are short, direct observation in clinical setting, 15 to 20 minutes with 5 minutes of feedback. Ang mini CX focuses on the clinical encounter, meaning history, physical exam, assessment, communication skills. Procedure naman yung direct observation of procedural skills. The example of the rating for this is this. Downloadable naman din to sa internet. It was first used in internal medicine residents. And then later, it was used for medicine. Tapos yung iba, nursing. So, nandito, evaluator, kasi nga first, una siyang ginamit sa residents. And then, the setting is placed. Ambulatory ba yan? Inpatient, emergency department, anong age ng patient, complexity of the case, which the evaluator will judge, and the focus of the assessment. There are only 7 items: medical interviewing skills, PE, professionalism, clinical judgment, counseling, organization, overall clinical competence. Sabi, some would say, parang subjective din siya eh. Wala siyang masyadong descriptions. So, meron siyang maliliit na descriptions dito, pero bakit ganon? Tapos, siyam. 1 to 9 yung rating scale na ginawa. 1, this is usually done for more senior trainees. Ibig sabihin kasi if you're just starting to teach them physical exam, hindi mo gagamitin to kasi it will not give feedback that type of feedback that you need. Kasi ang gusto mong feedback ay yung mas specific dun sa yung technique ng papercast o kaya yung saan ilalagay placement of the stethoscope. Very important for those who are beginning to learn physical exam. Introduction of self to the patient, no? Pagka nagsisimula pa lang mag-history. Pero pagka siya yung mga residente na o kaya interns na, wherein they're used to interviewing patients and they're used to examining patients, then the overall assessment would be enough. Tapos, yung ratings na ito, since there would be multiple ratings, ang sabi once at least every 2 weeks, ay mabibigyan naman yung trainee ng sense kung siya ay improving from satisfactory to superior or from unsatisfactory to satisfactory. So, nakikita mo yung improvement. That's why in 1995 ba to? 6? 95 ito, 96 yata yun pinublish nila. And they tried to see the development or the progress of the residents from first year. During the first year, every quarter ina-average nila. And there was really improvement, no, dun sa performance ng residents. So they said, it works because you give feedback. Kahit gaano ka ikse, it gives feedback. Kung halimbawang interview lang ang nakita mo, then you should rate this professionalism pa rin. Baka hindi na yung clinical judgment na may diagnosis, no? Pero halimbawa hindi mo nakita yung physical exam, then you shade that not observed para you won't take it against the trainee if this was not done because of time constraints. It's a compromise between doing a good assessment and, being efficient in terms of time. Para konti lang yung time requirement for consultants and they will do it thoroughly instead of just do it in retrospect, no? Yung halimbawa after na. The DOPS is very similar, may setting din siya, may patient, complexity. The procedure is named and then these are the items. Demonstrate understanding of the indications, consent, procedure preparation, analgesia kung sakaling they're the ones who are doing the sedation, no? Kasi merong iba, 'di ba, for minor surgery that they actually do the analgesia. Technical ability, aseptic technique, seek help, post-procedure management, communication skills. So, if you will notice, again, yung technical ability, which is really yung technique mismo ng buong surgery is just one item. And yet, because there's feedback, then it would still be clear to the resident, surgical resident naman ito unang ginamit, what is meant by a 3 or a 6, no? So, in time, they will know because they're given feedback. And since you have a variety of this being done, then the trainees will get a collection of parang ratings from different consultants. What about discussion of cases? Ito yung chart lang ang tinitingnan. So pipili ng dalawa o ng isang chart na kaso talaga nung trainee and then they will discuss the case. So ang titingnan ay clinical assessment, investigation, referral, treatment, professionalism. Bakit professionalism? Kasi 'di ba sa chart, makikita mong meron ding galit, meron ding red marks pa na all caps na meron mga ganong klaseng magsulat doon. And medical record keeping pati, no? So kung maayos yung chart, maayos yung documentation, that's also being assessed. Next is feedback-based assessment. Used to be called the 360-degree evaluation kasi kaya 360 degree babalik sa self. So lagi siyang may self-assessment. Who are the raters? Pwedeng pasyente, no? Peers, other members of the healthcare team. Kung clerk yan, di kasama ang nurse. Kung nursing student yan, di kasama yung kanyang mga classmates saka ibang members of the healthcare team at self, no? So you can imagine the number of kung ilan ba yan kailangan. The first time that this was introduced, 11 yung ginamit nilang raters per student. So kung 11 raters per student and you have 160 students, pero 8 are rotating with you at a time, marami-rami yan. No? Kaya nga, we're discussing this so that you will also understand, one, yung difficulty of having workplace-based assessment. Pero kasi pwede namang pumili kayo which you think is feasible and which is needed. For example, if you have residents, halimbawa training hospital, and if you have residents who are being parang if patients are complaining about the residents, pero kita mo naman na ang chart ay maganda at kompleto, pero yung interpersonal ang hindi, baka instead of the chart-stimulated recall, what you need is the multi-source feedback, and that's where you give that's what your residents need. Okay, so balik tayo sa outcomes. As I've said, hindi naman kailangan gawing lahat every week kasi wala na kayong gagawin kundi mag-check at mag-encode or hire a full-time, 2 full-time na secretaries to do this. So let's say that these are the outcomes. Pag-exam yan, your written examination can test clinical competence, yung mga legal aspects pwede rin, ang basics about research, minsan, di ba, pwede yan sa written exam. You can critique literature there, engage in lifelong learning, kasi yung mga ipinabasa sa kanila in SDL, pwede ring i-test. The OSCE, a structured, a standardized exam, can test clinical competence. Kung simulated, pwede ding leadership, kasi pwedeng may simulation for that. Professional legal standards because they will be talking to standardized patients, engage in research activities. Sabi, pwede ba yan sa OSCE? Yung OSCE kasi namin, there's a station with a computer. Tapos merong kaso or the previous case, ang gagawin nila, magsa-search sila ng literature, ng appropriate, or may nakalagay doon, and then they will answer questions na critiquing that or applying that to the patient. So we have done that as well. Pwede siyang gamitin, no? Na one station in the OSCE. Communication skills, obviously, kaya din. Ang documentation, these are case logs and procedure logs. So, hindi pwede yung iba, no? Direct observation, mini CEX, or the direct observation of procedural skills. So, clinical competence din, ethical, professionalism, at saka communication skills. Discussion of cases, competence, no? Ethica, professionalism. Kung yung iyong bang management ay evidence-based, it will also be reflected in the in your management of cases. And communication skills, but this time it's the written communication skills. And interprofessional collaboration, kasi you also communicate by way of the chart with the other professions. Feedback, yan, halos lahat, pwede. And portfolio, which is really the compilation of all the feedback, the written exam, yung lahat ng mga reflections ng students or ng trainees are placed there. So we will, or you will choose which ones from these, para siyang, ito yung variety of it all. So you will see, given the complement, your faculty complement, the time given to you, your dedication to assessment, and the outcome-based way. So, and then, you will have to plan the assessment for the students, or for your learners. Okay, last case na tayo. Kanina, PT. Sumunod, nursing. Na nag-OSCE. Ngayon naman, residency. Okay? Curriculum of the residency training in internal medicine in a hospital was revised. And right now, a lot of the institutions are revising the curriculum to ensure translation of learning to the workplace, to the existing year-end. So, ang usual kasi may exam at the end of the year, para kung ikaw ay papasa, ay mapopromote o hindi. And meron ding quarterly clinical performance rating by the consultant of the month. So to those two, they added several workplace-based assessment methods. So actually hindi some, several. Lahat dinagdag nila. Mini CEX, DOPS, CSR, and MSF. The consultants, of course, as expected, complained that these were too time-consuming and that, pangalawa, they were not sure ano bang i-assess dito, ano bang difference niya at napakaraming ratings na gagawin. What should be the focus during their encounters with residents? ito malimit din. Many of them will just give ratings in retrospect. Uy, end of 3 months na, kailangan meron ng rating. O sige, so nakakompile na doon. Eh, syempre, hindi mo na matatandaan ano nga bang performance nito, nung gano'n. So, nagiging retrospective, general na yung rating, no? Or, sige, pare-pareho na lang na, na superior. Pero hindi naman perfect, no? Kahit ang galing-galing. O kaya hindi mo masyadong matandaan, hindi mo rin ibabagsak kasi baka mamaya mamali ka nang hindi pala yun yung residente, kamukha lang, no? Many of them gave their, and feedback was often not given. Oh, okay. Okay naman, tapos, may clinic pa ako. O sige, next week na ulit tayo, So, walang feedback. The trainees themselves expressed mixed views about the value of WBA. Most of them were unable to complete the required number of ratings per year kasi kailangan mo, halimbawa, 11 na multi-source feedback. Yung pasyente hindi naman nagbigay ng feedback. They also complained that often the examiners focus on their documentation. Sinabi kasi, pangit daw po ang sulat ko, pero tama naman yung plano ko eh. Hindi lang maintindihan yung sulat. No? So, they complained that it's more of the documentation rather than clinical reasoning. Okay, ano yung mga problema dito? Anong mga assessment issues dito? Halimbawa, kung yan ay nakita nyo at hinihingi sa inyo ng advice.
Doctor, I think one of the main issues is the calibration of the evaluators themselves. Kasi more often than not, masyado silang bombarded na sa mga assessment tools. However, sabi nyo nga kanina, Doktora, they rate themselves retrospectively. So, may biases din at the same time, plus other factors as well to consider, like may clinic pa, hindi enough yung time para i-assess, toxic sila sa duty, and everything. So, I think one way to address this is probably, setting up a calibrated evaluation which would include all parties involved. And in addition to that po, Doktora, multidisciplinary sana kasi minsan what may be valid for, say for instance, doctor, and since this is a work-based assessment, it's also better to include the other disciplines because they themselves have different views of how, let's say, physicians evaluate their patient. And since team approach naman tayo sa isang pasyente, we all have our sabihin na nating say kung ano dapat yung approach. So I think that's just about it. Thank you.
Okay, thank you. So yun, calibration, hindi automatic yun just because you're part of the same department or the same field na alam nyo exactly what 4 means and what 6 is and ang difference ng 6 sa 7. No? Siguro in time, you can do that. Do you have any idea how we can do that, calibration for something like this? How one, in the oral exam of one particular subspecialty, ang ginagawa nila may video. May video. Tapos they will rate. Tapos they will discuss their ratings. So kung ibang-iba, ay may problema tayo kung ano yung passing. Ano ba yung passing? Ano ba yung tama? Ano ba yung excellent sa atin? Okay? And as you said, mas maganda rin if the all stakeholders are also involved. Okay? So ano pa ang ating pwedeng tingnan doon? Yan, ang dami nilang ginawa, di ba? Kaya retrospective, walang feedback, lahat ginawa. Of course, when you talk of competencies, it's good to have a lot of measurements or a lot of methods. But you need to be clear on what you're testing as well. Or the rater should know what it is that they are testing. No? Kasi minsan, hindi automatic na nakita nila, ano nga bang kailangan dito? So that the focus of the assessment may not be clear. Even here, in the table that I showed you is somehow will tell you which ones to choose, and then you can prepare the test blueprint for your particular department or for your particular section. And then select what methods should be used, the outcomes that are going to be tested or assessed by those particular methods, and ensure that there are a variety of cases. Otherwise, kung isa lang beses sa buong 3 taon niya doon, edi para lang siyang naging OSCE. Kasi naging isang station lang din siya, no? So that's the difference between the structured exam and the workplace-based assessment. Sunod, examiner bias. So may calibration, kailangan, hindi pwedeng retrospective yung assessment. And the examinees may also not, sabi yung issue sa examinees, one, they may not know what's expected of them. Anong level yung kailangan sa kanila. And second, they might not appreciate it. So parang kahit hindi naman kumpleto, okay na yan. Di ba? Merong iba, they don't take it seriously, so hindi na lang sila nagpapa-assess. And lack of standardization of the procedure. We've mentioned that. So we have to orient, hindi lang faculty pala, faculty, students, and all those involved on the focus. We use multiple raters, meaning you do it several times as well, and ensure that the cases setting would be similar, or at least there would be a variety, no, for the trainees. Practicality, the same, no? Lagi nating iisipin, of course, we want to do it the ideal way. O dapat maganda, may variation. Marami, we use various methods. Pero we also have to know that we're limited by number of faculty that we have, the time that we have. So this will be scheduled para hindi magkakaproblema. Okay. Sabi nila, after everything that I've said, all methods of assessment have their strengths and intrinsic flaws. Sabi, sige, pwede na tayong umuwi kasi wala naman pala talagang perfect na assessment method. No? But the use of multiple observations and different assessment methods over time can partially, hindi nga completely daw, partially compensate flaws in one method. The flaws, yan ha, in one method. This is by Epstein. Similarly, sabi naman ni Miller, it seems important, we're not starting but we're ending, to start with the forthright acknowledgement that no single assessment method can provide all the data required for judgment of anything so complex as the delivery of professional services by a successful physician. Siyempre, pareho din to sa iba't ibang health professionals as well. That's why we need to put together all of this, consider our outcomes, and consider what we want to assess in our students. In summary, the why, the what, and the how, we want to do outcome-based assessment so that it will provide direction and motivation both to students and to faculty. We want our students to know what they already know and what they don't know yet. We want to motivate them to want to learn more, and we want to improve ourselves as faculty and as assessors as well. We want to protect the public, the patients. We want to protect society so that we maintain the standards of the profession. And we want to be helped in making decisions regarding recognition and promotion and otherwise. What do we assess? We assess learning outcomes. We assess all aspects of it and not just one. Knowledge, skills, and attitudes. We want integration in our assessment, and we want it to improve, to move from the lower order to the higher order, increasing in breadth, in depth, in difficulty, and in utility. And how? One, we have to make them to ensure validity, which means appropriate and meaningful inferences can be made by using the test blueprint. Kahit na ano yan, kahit na may assessment plan, kahit na hindi written exam. Kahit hindi written exam, we want to make it reliable by orienting our faculty, orienting our students, and making sure that our tools are reliable, that our tools are easily understandable. And second, of course, we want to make it practical. No, we want to make sure that within the time, depending on the number of faculty, the commitment of the faculty, and the logistics that we have, we are able to do it and to do it well. Ang laging sinasabi ng outcome-based assessment ay no child left behind. So at the end of it all, we do all of this. We give feedback, not just for assessment of the learner, not just assessment by the learner, but because we want to help the learner to assess themselves and to improve. At dyan po nagtatapos ang ating outcome-based assessment. Questions? Questions po?